Welcome to episode 1 of the Unspoken Side of Breastfeeding, brought to you by Grow Anglo Mama in collaboration with Momcozy. My name is Sophia Mastan. I'll be the host for today. So today we're joined by Dr. Rachel, a doctor and lactation consultant, to explore two experiences that are rarely spoken about, which is D-MER or Dysphoric Milk Ejection Reflex, and the grief that can accompany the end of breastfeeding. Together we'll discuss why some mothers experience sudden emotional lows during milk, letdown, the hormonal and emotional changes that can follow weaning, and when professional support may needed. This is a safe, compassionate conversation for every mother who has ever wondered, why am I feeling this way? You are not alone. Your feelings are valid, and the way you feed your baby does not define your worth as a mom. Dr. Rachel, thank you so much for joining us. So let's begin. Dr. Rachel, thank you so much for joining us. So let us begin. Maybe you can introduce yourself first, one more time.
Sure. Hi, I'm Dr. Rachel. I'm a doctor and an IBCLC, an international board certified lactation consultant. So what I do day in, day out, I see breastfeeding mothers, I see babies and children as well. That's what I do.
Yeah, thank you so much. So you will see the mom, you also see babies. So
Yeah.
you are the whole, like, people can come and see you to actually check everything.
Hopefully.
The whole ecosystem. Okay.
I try my best.
Let's talk about D-MER. Thank you again for coming and being here with us. So for someone hearing this term for the first time, what exactly is D-MER?
Okay, so let's go into what the words mean first.
Yeah.
So it's Dysphoric Milk Ejection Reflex. So then people will be like, what is dysphoria? So then you think of the opposite word, euphoria, right? So euphoria actually means overwhelming joy. So you think of the opposite of that, that's dysphoria. That's the sensation that they're feeling, this sense of doom, this sense of helplessness. Okay, and so dysphoric milk ejection reflex, it basically means that it's a physiological condition that happens when a mother experiences this overwhelming sense of negative feelings that comes right before or during their milk ejection reflex, when they have a letdown.
Okay, so this is the feeling. I mean, I had this feeling when I first breastfeed.
Oh, I see.
And it makes me feel very sad. And whenever I ask people, they always say it's normal. Oh, it's normal. You always feel like it. So apparently more like a lot of mom actually felt like this, but they don't know what is it. Until today, I actually learned, what is D-MER. So it is dysphoria, means you feel very sad.
It may not be sad,
It might not be sad.
Yeah, it may be depression. So one of it
Okay.
is sadness. Another one is anxiety. You may feel overwhelmingly anxious, like the world is coming to an end, just like this sense of like hopelessness. And it could be agitation, intense anger, and just overwhelming like hatred, like why am I doing this? That kind of feeling. Yeah.
Wow. So what happens in the body at the moment milk lets down?
Okay. So let's get into it.
Yeah.
I hope you remember your biology from Form 5. Okay. So when the baby suckles, or when the breast pump is on the nipple, or when the mother thinks of her baby, or she hears like the baby crying. Okay. Then the body is sent a message to the brain, and the brain will release this hormone called oxytocin. And so oxytocin will work on the breast to release those milk there. So that is the milk that's already ready in the breast. At the same time, there is another message sent to the brain to tell the brain it's time to make more milk. And so for this milk to be produced, the hormone prolactin needs to go up. So for hormone prolactin to go up, another hormone needs to come down. The whole hormonal system in the human body works like politics. There's always, there's the government, and there's the opposition. There's always checks and balances. So when one hormone goes up, the other one has to come down. And so happens that the hormone that puts the brakes on prolactin happens to be dopamine, our happy hormone. So when the prolactin hormone goes up, then dopamine has to go down. And so for mothers with D-MER, not every mother experiences this, but for mothers with D-MER, she senses this drop in dopamine, and her emotional center kind of short circuits and says that, oh no, now it's time to feel very, very sad. But for other mothers that do not have D-MER, then for them it's okay. the system knows that, okay, this is just a transient change, we'll just weather it and it'll be okay. Yeah. So I'm very sad to hear that you were told that it was normal, because it's not normal.
Because you feel this sense of sadness, just like you say, drop. It drops suddenly. Like you feel okay 1 minute, the next minute you just feel like your whole world is crumbling down just because you breastfeed. And because of that, I don't like to breastfeed. Because I don't like that feeling.
It's so understandable, right? Who likes to do something that makes you feel that way? Yeah. And there's also another physiology hypothesis to it, where they say that the hormone actually, for some mothers, it's like going down a gentle hill. For some mothers, it's going off a cliff. So when you go off a cliff, then that's why you feel that way.
No wonder.
Yeah.
So I know I say that the feeling is sad, but you said it might not be sad. So how might a mother describe D-MER if she doesn't know the name yet?
Okay. So I've told you about these 3 kinds of feelings already. Either it's depression, anxiety, or agitation. But recently I came across this description which I feel is just so apt. So have you read Harry Potter?
Yeah.
Yes, you've read Harry Potter? Great. So you know Harry Potter talks about dementors?
Yes.
Yes. So that feeling, it's right about when you're going to have a letdown, and that's when the dementor is right next to you, sucking all the happiness out of you, and just you feel this sense of doom and hopelessness. And then after that, the dementor goes away, your letdown is over, and you're back to yourself.
Yeah. Oh my god, that's such a good.
Yeah. So when I read that
explanation,
was just,
it was like on point.
Amazing. Yes.
Like I would love to make the other new moms understand that, you know, like when you have maybe a cousin or friend that have this feeling and you don't know how to, because I wouldn't know how to describe it until I learn more about D-MER. So like you say, why does this feeling arrive? I think you explained it so much better with the dementor. So my question was actually, why does the feeling arrive so suddenly and disappear within minutes? Okay, does D-MER happen only during direct breastfeeding, or even pumping can trigger it as well?
Okay, so that's an excellent question. So it is most commonly triggered by breastfeeding, by direct nipple stimulation. With pumping, a lot of mothers have said that there will be less of this feeling, and if they were to hand express, there's even lesser of this sensation.
Oh, okay. Hand express with manual.
Yeah,
breast pump.
manual. No, meaning that you really use your hand to hand express. Then they seem to experience lesser of these feelings, but we don't know why.
Okay. So, I mean, of course, we're talking about D-MER. Also, of course, you just gave birth as well, so you were breastfeeding, and sometimes this happens. I know this through my experience, that this happens during the first few weeks of my, like, you know, after I gave birth, and I have this feeling. But I also was diagnosed I had postpartum depression. So how can someone distinguish whether they have D-MER from postpartum depression or anxiety?
Okay, so there's actually 2 questions over here, so I'll just unpack it a little bit. So first thing is the diagnosis of D-MER. So D-MER is very specific. This sense of sadness and hopelessness and doom and everything will happen right before letdown and during letdown, and it will resolve after that. There's no more of this feeling. Okay? Whereas, say, if you were talking about nursing aversion, when you just feel a lot of resentment and you're very upset about the whole breastfeeding process, it happens throughout the nursing episode. And for postpartum depression, you'll be sad the whole day and whole night. Okay. And it is pervasive, and it happens the whole way. Yeah. Okay. And it will affect your function.
Have you had any experience with any, of your patient that has D-MER before?
Yes, I have. At that moment, it took a long time to get her to admit that she actually had this feeling. Initially, she was just saying, oh no, I just don't like breastfeeding. And I had to probe quite a bit. And then suddenly she broke down and said that the reason why she doesn't like breastfeeding is because it just makes her feel so sad. And she feels that it's wrong for her to feel so sad, because she's supposed to enjoy breastfeeding, right? She's supposed to enjoy being a mom. So, but she doesn't get it why. So, but very sadly, at the time when I met her, it was already around 7 months, and she had totally dried up, and she wasn't keen to explore breastfeeding anymore. Yeah. So, but I told her that if you have another child, then come to me early and let's try and fix it early on.
Okay. Yeah. Oh, so you can actually fix it early on? That
it is not really that you can fix it early on, but from many patients' testimony, knowing that this is a condition and it's not in your head, it has already won half the battle. So
Okay.
just validating her feelings, just help her to win half the battle. And then of course we have some strategies as well that we can use to help relieve this feeling.
Okay, okay. I mean that's great. What can how can mom prevent this from happening during their pregnancy? Is there any way mentally or even like something that you can do?
No. I mean, okay, so this way you're kind of thinking about it as though it is something you can control.
Yeah.
But and then you will get a lot of guilt along with this.
Yeah.
Yeah. So no, it's like an allergy. How are you ever going to prevent an allergy?
allergy.
Okay. Maybe you could avoid triggers, but in this case, the trigger is something that you cannot avoid. Yeah. So it's something physiological. It's something that happens. So there's really nothing you can do to avoid it. But being aware of it helps a lot, because
Correct.
when you tell yourself that it's not just in your head, it's something that's happening. It's a dopamine crash, and it will pass. It will pass. Telling yourself that sometimes helps to alleviate it.
Okay. Well, that's good to say like you will pass.
Yeah,
Put that
it will
inside
pass.
your head.
You tell it. You tell yourself. You
Yeah.
know, sometimes when you're doing your plank, also.
Yeah.
Like so long.
It will pass. It will pass. Yeah. Okay. Are some mothers more likely to experience this than others? Like, is it a choice? Like, if you are a C-section mom, probably, or if you're normal, if you birth normally, is there any? How can we? Some mothers are more likely to experience than others.
Yes, there are certain risk factors.
Oh, okay.
Okay, so one of them you have correctly mentioned yourself already. So either during the pregnancy itself, you have some mental health disorder, whether depression or anxiety during the pregnancy, or postpartum. If you have postpartum depression or postpartum anxiety, you are more likely to develop this. Okay, or even pre-pregnancy, just in your normal day life, this person has had a previous mental health disorder, they are also more likely to have it. Okay, now during postpartum period itself, if you wanted to reduce the risk factors, one of it is getting more sleep. Yeah, sleep deprivation, caffeine, dehydration, and I think that's about it.
Okay.
Yeah.
Okay. Next question would be, what can a mother do in the moment to make this experience more manageable?
Okay, I'm really glad you asked that.
Yeah,
Okay, so mummies, listen up now.
Besides saying,
take some notes.
like,
It
okay,
will
we'll pass. Yeah.
yeah, something more concrete,
Yes.
right? Okay, so something really, really helpful is to drink ice water.
Oh.
So prepare a thermos of ice water. Really simple, right? Everybody has
Yeah.
water, everybody has ice. Yeah. So focusing on a different sensation. Because you're like, the baby's on the breast and then you're like feeling that sensation. So focusing on another sensation beside it. So, it can be ice water. Unfortunately, not your ice latte, because caffeine is a risk factor.
Oh, okay.
Yeah. So besides that, having a meal, that helps too. Just focusing on something else. It doesn't even have to be gourmet. Maybe you're making me also can already. Oh yeah, you're supposed to eat healthy, right?
I love that the doctor said that. Okay, Maggie me.
Oops. Okay, yeah. So having a meal, as well as listening to music, yeah, and aromatherapy, and also mindfulness breathing. Yeah.
Wow, it's as simple as drinking water. So some people think so hard, like, oh, how do I need to do this, I need to open all this music or buy this, but suddenly you just said just have drink water or eat.
Drink cold water.
Cold water.
Yeah.
But even though I think a lot of the pantang lady will be like,
Yeah.
but then again, listen to your doctor. Okay. When do you think that they should speak to an IBCLC or a mental health professional? I mean, at what until what point? If let's say they cannot take it.
Okay, so here's the thing. If you spoke in the beginning and you got a diagnosis for this, I think that would make you a lot happier already. And just learning all these other strategies, the grounding and one more, mindfulness breathing. Yeah, so all of this, learning these strategies would really help the mother. Assuming the mother already knew all of this, then the stage where she would need to seek help would probably when she feels that she cannot continue with breastfeeding because of this, and she really wants to continue breastfeeding. Then that's the time that she should seek help, because there are some medication that can potentially help. Another reason to seek help would be because even though D-MER does not cause postpartum depression, it is a risk factor for postpartum depression. Because imagine if you feel sad, every 3 hours or so, the chances are you're gonna probably want to feel, you probably might feel sad for the entire day as well after a while.
Okay.
Yeah.
That's nice to hear. Okay. Now I'm talking about working mothers, right?
Okay.
How might D-MER affect a working mother who has to pump during a busy work day or in a shared workplace? I understand you said just now that if you're pumping, then you won't feel as much.
It's usually not
so much. But sometimes when they feed it and they're at workplace, right, they have to pump outside. So there's no privacy. Like if you're at home, like you say, you can on some, relaxing music, drink cold water. How might this, affect a working mother?
So it definitely can affect the mother very much, especially when you're at work, you've got lots of stresses, your boss is hounding you, you also know you cannot pump too long. Yeah. So prepare. There's no other way to say this. I say this to all my working mothers as well. The more we prepare beforehand, the less we will be stressed by, the circumstances that can happen. Yeah. So already prepare beforehand. So have your noise cancelling earphones on. Already prepare your playlist before that. So husbands, this is an area where you can help. You can definitely put in a playlist of all her favorite songs or podcasts, mama podcasts to listen to, like this one. Yeah. So help her prepare. You can definitely prepare a thermos of ice cold water to drink during this period. Yeah.
Oh, I love that.
Yes.
I mean, it's not so hard. It's just ice cold water. Because moms, sometimes they don't want to think too much. So this tip is very good, and I would forever remember this ice cold water. Okay, how might the experience differ with a stay-at-home mom who breastfeeds frequently and has fewer opportunities to step away? Because I think working mom, they have their time, but stay-at-home mom, they're 24/7 there.
And they're forever facing
Correct.
the baby. There's no off. Yeah.
Yes, there's no off
totally
switch.
get it. Yeah. So I think for the stay-at-home mom, if there is someone else who can help you, who can, just pop in, you can speak to that person. That person who always said, let me know if there's anything I can do to help you. Then you say, haha, there is something you can do to help me. I need 20 minutes every day. Can you just pop in and take care of the baby? Maybe help me with this one feed. You do the bottle feed for that feed, and I will step away for that time. Sometimes just knowing that you have this break from the entire cycle of feed and sleep and burp just helps you to just let go and be able, you feel like you're more able to face the rest of the day. Yeah.
So that's what a partner or a family member could help, as in
yes.
who moms who actually feel emotionally overwhelmed with feeding.
Yeah.
So to help them in terms of that, also helping them with house chores would also.
Oh, for sure. Yeah.
Okay. What challenges may arise for mother who exclusive pump, combination feed, or return to work while weaning?
That's a pretty loaded question.
Yeah.
Okay, so that means that she is trying to wean while returning to work.
Yeah.
I think it's more about the emotional aspect of things. Okay, one thing about weaning is that you're trying to drag pumps, right? Most of the time. So when you're also working at the same time, most of the time you're very stressed. You might miss pumps. Your boss calls for a sudden meeting. So most of the time, what we're facing is clog ducts as well, and mastitis. Yeah. So that is probably the biggest challenge of a mom who is trying to wean while going back to work.
Okay.
Yeah.
Okay. One of the things that I feel like mothers have trouble with is communicating.
Okay.
So communicating with their partners, relatives, or even like their health practitioner. Like you said, sometimes they have this D-MER feeling, but they don't know how to say it. So how can mothers communicate their needs to these certain people around them? If let's say they are emotionally challenged or like breastfeeding, they're struggling with breastfeeding or something. Yeah.
Just saying I need help would be a very good start. I believe that a lot of the responsibility falls on us healthcare professionals also. We should be better at asking the mother how she is. Yeah. And knowing and not taking the surface, I'm okay, as surface. Then look at them one more time and asking them again, how is breastfeeding doing for you, or how do you feel, how are you coping. Asking it once or twice, you may not get the answer the third time. Most of the time you may get the answer. And for the mom, some of my moms find it really hard to talk to me in the consultation. They feel very comfortable texting me a long essay after that. So for my breastfeeding mothers, I allow that. Yeah, you can go ahead and text me, and then after that, I will respond at an appropriate time. Yeah. So sometimes just writing it down. So I have moms who come in with a notebook. These are all the questions that I want to get through
that
today.
Helps.
Yeah, that really helps, because mom brain, right? You can't really remember what you wanted to ask in the first place. So just writing it down when you remember, and then just coming in, and then just
I think that's why journaling helps. So if you don't know what, some of us are not good with words, or even if you're good with words, sometimes during that time, that emotional feeling, you don't know what to say, especially when the doctor is in front of you or a consultant is in front of you. So writing it down, I think that's a good tip, doctor, to write it down or even text a long message, because then only you can think. Okay, regardless of how a mother works, feeds or weans, what do you want her to know about her worth as a mom?
I love this question. It's what I tell parents a lot. So I really want to say that regardless of how you feed your baby or what you feed your baby, it doesn't determine your worth as a mother. It's just like how you feel towards your baby, right? Your baby did nothing except look cute, maybe. And you love your baby so much already. So that's the same. You are your baby's mother. No matter what you did or what you didn't do, you will forever be baby's mother, and you will forever love baby. So let's just switch perspectives for a little bit and say it was your daughter who was, for whatever reason, she needed to wean her baby off early. You're gonna tell her, sayang, it's okay. You did your best already. Show yourself some grace, right? So in the same way, show yourself that grace, because you are your baby's role model. So you need to show yourself that same grace in order to be that mother that you want to be to your baby.
Oh, that's so beautiful. I love that. I hope that helps a lot of mom listening to us today. And okay, last question about D-MER is, so this D-MER it's a psychology, is it? It's a feeling?
It's not a psychological condition.
Okay.
Yeah, we are still naming it as a physiological condition, but with some psychological side effects.
Okay. I mean, I want to understand that. And I think that's all for our podcast. Do you have anything else that you want to add, doctor?
Yes, I do.
Okay.
Yeah. So D-MER, for all the healthcare professionals out there, D-MER is still not in the DSM-5 or in the ICD-11, meaning it's not a recognized condition for which we can give psychiatric medication. But there have been some encouraging evidence that there are some medication, some psychiatric medication, norepinephrine dopamine reuptake inhibitors, that seem to help these mothers control their symptoms better, and to some extent even relieve their symptoms altogether. So in Malaysia, psychiatric medication is regulated very strictly. So I, as a doctor and an IBCLC, cannot really prescribe this medication. So if there is any perinatal psychiatrist out there who is interested to know more about D-MER and you'll be interested to collaborate, I'll be really, really happy to hear from you so that we can see how we can provide better for our patients.
That's great. Can you also share, doctor, your Instagram, just in case anybody wants to reach out to you?
It's Dr. Rachel Ooi. So just DRRACHELOOI.
Yes. Don't forget to also follow Momcozy, MYSG, and Grow and Glow Mama. So Dr. Rachel, thank you so much for joining us and for helping us better understand D-MER. I've learned so much in this 30-minute session, and the emotion surrounding weaning and the many different realities of mothers. And I love your last word about, what's the message for the mothers, whether you're weaning and all these things, because sometimes moms, they put so much pressure on themselves, and we need healthcare professionals like you that I feel like you accept mom in any stages that they are in.
And I really want them to know also actually that help is always available. You really don't have to struggle alone. there's no medal for you struggling alone with your cracked nipple and your and all the tears and everything. Go ahead and seek help, and really help is out there.
Correct.
And help is not there, then I'm there.
Yes, and now we have social media. We can always DM doctor if you need, or even Momcozy Instagram as well if you need any, like, even conversation, or even if you have any questions. So if you're listening and any part of today's conversation resonated with you, please remember that you are not alone. Your feelings are valid, and reaching out to support is not something to be embarrassed about. It will actually help you, but reach out to the right people, a lactation consultant, doctor, a mental health professional. It's actually a sign of strength if you ask for help, because you want to be a better mom.
Yes.
And in order for you to be a better mom to your children, you need to be better for yourself. So always remember who you are. Like the topic, basically our thing today, Momcozy said, breathe and breastfeed. Remember to breathe first before you breastfeed. However your breastfeeding journey began, changed, or ended, it does not define your worth. You are more than how you feed your baby. Like I said, at the end of the day, you are human. You are you before you are a mom. So you are amazing already, because you grew a baby in your tummy and then you give birth and feed your baby. So thank you so much for listening. The Unspoken Side of Breastfeeding, brought to you by Grow Anglo Mama in collaboration with Momcozy. We'll see you in the next episode. Thank you, Doctor.
No problem.